Dr. Leith, and I'm going to go over the historical, cultural, and ethical considerations for assessment. So I'm going to close out my video here because it keeps crashing. So let me close that, and it looks like we're okay. I hope everyone's doing well, staying healthy, and let's get to it. So you might be wondering, as we all often do, how did assessment come to be? And it started around World War II, and you might be wondering, why do I need to know this specific fact? And aside from it's part of the counseling lore, it's also on the NCE, right? So as the military was growing, the government wanted to match people with jobs that they would excel at. Right? So if you were good with numbers, they wanted to put you in a numbers job. If you weren't good at visual spatial things, then they didn't want to put you there. So they came up with this idea of aptitude testing, right? And that's where ASVAB came from, right? So that's kind of where it started. Now, after that, people started thinking about, hey, does this concept of fit also apply to other careers and other professions? And so I don't know how many of you did this. I'm pretty sure everybody has to. You take a career, excuse me, a career course at some point in K through 12. I took it in fifth grade, and they gave us a Scantron, and they asked questions like, do you like people? Do you like numbers? Do you like writing? And naturally, I said no to all three. And then it tells you what job you would best be suited for. So this is an age-old concept, but you may recall from either the career counseling course or the introduction course that professional counseling stems out of career work, right? That's where Frank Parsons starts saying, hey, if you're in a job that you're unhappy with, this can really wreak havoc on your life, right? We can have depression level unhappiness simply as a function of being really unhappy with your job. So this idea of, can we match people to jobs that they would excel at and also be happy with, that really took off. Then test developers and researchers started making more sophisticated assessments, right? So the very first thing was probably really basic, kind of like the example I gave a minute ago. Even though I was being tongue-in-cheek, they were being serious. Do you like numbers? Do you like writing? Do you like people? Can you draw? Right? And so it became more and more sophisticated as academia came into it, as business came into it, right? Let's jump in the race to make the next big assessment. We want these companies to buy our product, to use our assessment, right? And so that propelled research. And so as counselors, we're interested in the mental health and the well-being of our clients. And we got in there as well with career satisfaction. You might remember from career counseling if you've taken it, and if you haven't, this is a little spoiler, trait and factor theory, things like that. Then, of course, assessment branched off into what other things can we try and measure. Now, remember, this is a good example from the first week about latent constructs, right? Career satisfaction and what would you be good at. We can't just look at a person and tell, nor can you take a blood sample and figure this out. We've got to make some sort of instrument to kind of figure out, which means we have to, what is career satisfaction? What is skill? What is an appropriate level of skill, right? So that's where all that comes from. So that then spun into all the different mental health and well-being aspects of life. So just a refresher again, the most important reason to assess is that we're monitoring and tracking and getting that baseline, right? This way we know what's needed, we know if it's working, we know if it's effective, or do we need to switch strategies? Do we need to help our client with something else? Excuse me. So we've got all this competition now, right? We've got these different test developers coming up with different types of tests, right? And I promise you, if you name it, there is a test for it, right? Later on in the semester, I've put up an article on the, I think it's either Facebook addiction scale or Facebook intensity scale. There's a scale for binge watching TV. There's a scale called the gradients of evil, right? So there's all sorts of different assessments that range from these very concrete, rigorously tested assessments to ones that are, really just kind of pieced together, right? We can go onto BuzzFeed and get an assessment, which Harry Potter house do you belong to, or let us guess your personality based on how much you like garlic bread. Things like that, right? Those are assessments, but not all assessments are created equal, right? There are some that are better than others. And that's why it's really important. So this is a kind of a practical piece. I'm going to venture out and assume some of you are thinking of private practice, or even if you want to start an agency or you want to improve and you think, hey, I can get more grants and I can be more effective if I use assessments. And that's true. You have to keep in mind that there are a lot of really bad assessments and there's a lot of really great ones, but that means you have to do the legwork to see what's good and what isn't. All right. So Barnum from Barnum and Bailey Circus, also the Greatest Showman, he's noted for saying two really key things. I mean, he's also known for a bunch of other things, but he's also known for these two things. There's a little something for everyone, right? He said that about his circus. And there's a sucker born every minute. And those two quotes apply to assessment, or to the assessment trade, right? The developing of it. If there's an instrument, you need to kind of vet it, right? Because there really is versions of everything and measures for everything. In fact, we call this the Barnum effect, right? That there is an instrument that it claims it can very accurately detect pathology. It can very easily detect family functioning, you name it, right? And it's inexpensive and it's time efficient. But then there's also a sucker born every minute. And we realize that these assessments, to be good, have to go through a lot of rigorous testing. So the Barnum effect, this especially applies to things like personality, which are really amorphous, have lots of moving pieces to it that can change. Things that are open to interpretation, right? There's always some assessment. And these developers, people want you to use their tests because either A, it generates money for them, or B, it generates an accolade for them, right? So that's what this course is about, in part, how to select an instrument. So think of, these are two examples. The Barnum effect refers to an assessment giving a result that could apply to anybody, right? Excuse me. So for example, Janet, these results indicate that you like a quiet night at home with your family, but you also like a night out with your friends. Or Jackson, you like to have attention, but not all of the time, right? These are things that apply to all of us. You like to work hard, but you also like to relax, right? You like to indulge, but you also like self-control. So that brings us to ethics. And so we're going to go over the ACA Code of Ethics and the Texas LPC rules on assessment. So we got to review those because you have an ethical obligation if you're going to use an assessment. So the immediate ethical concern is selecting the appropriate instrument, right, if assessment is needed. So I guess maybe that's like part 1A and part 1B. If an assessment is needed, right, don't go and just use something because you can, right? When all you have is a hammer, everything looks like a nail. And so when you graduate, you're going to be able to use a ton of different assessments, right? You're going to be qualified to use them. If you take the advanced assessment course or get a doctorate, you'll be able to do even more, right? So it's determining, is this type of assessment needed? Because there's all sorts of things you got to consider, like cost, who's going to pay for it, et cetera, where do the records go? And then selecting the appropriate instrument. So you did determine that the person needs some sort of formal test, some sort of formal measurement. Now you got to pick the appropriate one, right? And there's a lot of things you got to consider, and we'll go over those. Being qualified to use the assessment instrument, right? And then client rights. For picking the appropriate instrument, if you want to measure something like, I want to detect PTSD in a person, then you should, it's common sense, but the fact that we have to go over it means someone out there was not doing this. If you want to measure PTSD, use an instrument that measures PTSD. Don't get an instrument that measures general anxiety, right? If you're deciding if this person, qualifies for an accommodation or something, then use an instrument that is in line with that. Right now, there's much to do about the use of emotional support animals and therapy pets, right? So with the emotional support animals, a lot of times apartments or schools, like in their dorms or jobs, they need a letter from a mental health professional. Well, how is that person determining it? And this is not me being anti-emotional support animals, but it's about going the right way so that we keep our legitimacy as a organization and as a profession, right? How did you determine that this person needed it, right? Versus the person is just attached to an animal that they adopted. If you're going to remove a student from a class or have them move to a different school or something like that, if you're going to recommend treatment, what are you basing that on? So picking the appropriate instrument or technique. Qualification. So this is important to know, and we'll see it again in a little bit. But there's 3 levels of qualification with assessments. And then before I move forward, let me make sure I don't. There. So A, B, and C, with A being the most accessible and least complex assessments, and level C being the more restricted, very complex assessments. So the more complex and the more rigorous a test or assessment becomes, the more restrictive it is in availability. So for example, the Beck Depression Inventory or the Patient Health Questionnaire, very easy, single sheets, 9 or 10 questions, multiple choice, right? I strongly agree to I strongly disagree, things like that, Likert scales. We give to the client, they answer the questions, we tally them up, and the higher the score, the more the severity. Something like that, anybody can do as long as they have the appropriate training, right? They read the manual and had some form of training. And then on the other end of the spectrum, we have something like an IQ test, right? Like the Wechsler Adult Intelligence Scale, which is used to measure intelligence. And that's a very complicated test that takes hours upon hours to do. And it has a very rigorous administration and scoring and interpretation to it. And so there's a lot of room for error with it, so it's more restricted. When you graduate, you will be able to do level A and level B assessments, right? So A would require some kind of training on the instrument. B requires that you have a master's in or a graduate degree in a helping profession. So counseling, school counseling, social work, psychology, things like that. So you'll be able to do both of those. And typically what happens is you would find the assessment at a test developer's website, Pearson, things like that. And you go to order it, And along with all your other information when you're setting up your profile, they ask to see your transcripts to see that you have an assessment course listed on there. To go back, C, to do the C test, which would be like the really in-depth personality assessments, IQ testing, those would require that you take the advanced assessment course or have a doctorate. The doctorate, getting one means that you have to take advanced assessment, but those would enable you to use those tests as well. Excuse me. So client rights, this is, in my opinion, the most important aspect of it, right? Being respectful and ethical towards our client. So in short, before we kind of do the deep dive into the code of ethics, clients have the right to understand the assessment process, which assessment, why you're doing it, why that one, the cost and the method. Cost is the big issue with testing an assessment because typically insurance doesn't cover that, right? They'll cover the time that you spend to administer it and score it, but the actual kit, the actual test, right, that you got from somewhere, that has to be paid for somehow. And maybe we talk about that a little bit later on if there's questions. They should be made aware of results and whoever else may be told the results, right? So if there is a legal issue or maybe like a custody issue, it's very common for parents to have to take the MMPI-2, which is a personality test. Who else is going to know about these results, right? Well, in a legal case, probably legal counsel, probably a judge. Is the person's physician, pastor, dentist, neighbor going to know? No, right? Will insurance know? And does that matter, right? Where does this go? What if it's for a job? And be made aware of any discomfort that might come up with the assessment, right? Some of these assessments, you're going to ask really questions that make people uncomfortable. But this is no different than giving informed consent, right? Some of these questions are going to might make you frustrated, right? If I'm trying to see, think of a child or a teen and we're testing for math ability. These questions are going to get harder and harder and harder. So frustration is to be expected. If I'm asking questions about, mental illness, and then I got to ask questions about family history, someone might feel uncomfortable. If we're doing addictions, right, there might be stigma or shame, but it's all contextual. It's being made aware. That's what it is. And, are you comfortable doing this? And is now a good time, or do we need to wait? Things like that. So just being made aware that they know what they're going into. So that's it for this part. I'm going to stop here on this video and make another one where I go over the Code of Ethics and the Texas LPC rules. And then that'll be it for this week. Next week, we're going to be going into we're going to start doing some of the heavy lifting. So I'll wrap up here and I will talk to you again in the next video.